Okay, students, today in class we'll be finishing up with our student speeches regarding anatomy and physiology, topic of your choice. Do I have any volunteers? Rebecca, why don't you get us started?
Oh, I decided to choose homeostasis as my A&P topic. I had a bit of trouble understanding the concept, specifically the negative feedback loop. I mean, isn't negativity a bad thing? How do we even maintain a stable internal environment anyway? The first example in our book is about temperature regulation. As our body temperature rises, receptors in our skin send a message to our control center, alerting we have a problem. The control center then sends a signal to an effector to take action. In the case of being too hot, we begin to sweat and our surface blood vessels dilate. For this process to make sense to me, I stopped looking at it as a negative and more like the body doing an opposing action, in effect, subtracting the negative factor to return to an equally balanced scale. Not too hot, not too cold, but just right. As we have progressed through the chapters, it has astonished me how well our bodies maintain homeostasis through constant chemical reactions. Adding a little sodium here and a dash of potassium there, move some calcium from this cell to that cell. Well, it's super cool and extremely important to understand. It helps answer the question students have annoyed professors with for centuries. Why do I need to know this? Because by having a thorough understanding of the correct way our anatomy and physiology function together to maintain a stable internal environment gives us the knowledge to recognize how and why we lose homeostasis through disease or injury, and then ultimately how to fix it. Guess who must keep a patient in homeostasis if his body can't? Yep, the healthcare professional. Here's a few examples of homeostatic imbalances that we can recognize from our studies so far. A patient comes in for a routine blood test and his glucose is over 200. Remember, our bodies love sugar, who doesn't, and use it to fuel our cells, but they can't access it without insulin. Right, his pancreas isn't making enough insulin and he's probably developed diabetes. How about if a routine test shows increased calcium levels in the blood? Sure, we should check the health of the parathyroid. She could have hyperthyroidism. Oh, I've got one for you. A truly perplexing case comes into an ED of a previously healthy 14-year-old boy presenting with a severe headache and vomiting that has lasted for over a week. Upon closer observation, you notice his eyes do not track together, and he begins to complain of double vision. This could indicate a problem with his cranial nerve 3, octomotor, or his cranial nerve 4, trochlear. An MRI is scheduled right away. That's weird. The MRI is normal, but his brain is showing all the signs of a brain tumor. What could it be? If you're stumped, don't feel bad. So were 5 other doctors in Tampa Bay. Luckily for my son, some brilliant doctors at Johns Hopkins Children's Hospital accurately diagnosed him with pseudotumor cerebri. His brain gave all the symptoms of a tumor, but he was actually suffering from an increased cranial pressure from too much cerebral spinal fluid. A lumbar puncture to reduce the CF, and he was good as new. Now, had this happened 500 years ago, he probably would have gotten a couple holes drilled into his head to let the evil spirits out. And that's the takeaway. By mastering anatomy and physiology, there are no more unneeded holes drilled into our heads. We have developed less invasive ways to treat depression other than sticking a sharp object into our frontal lobe and giving it a little jiggle. And my personal favorite, we stopped using leeches to cure anything we couldn't explain. All very good things.
Thanks, Rebecca. Okay, class, we need to stop here so that I can set up today's lab.